Now, I mentioned also earlier that John Kasich had a couple things to say last night that just, well, they were frustrating just a little bit. And here's one of them. They were talking about the individual mandate and health care and Obamacare. And Kasich, once again, was saying, well, look, I'm the only guy up here that's ever done anything here. I'm a governor. These guys, I'm a governor. And we governors, we got to work with people. We got to cross aisles. We got to solve things. We got to get things done. We just can't pass things off. We got to get things done. I got to get done. Just waving his arms and hands up there. And he announced a way to lower health care costs and talked about how he's doing it, they're doing it in Ohio. And this soundbite is a fairly good example of what he was talking about.
We have a proposal, a plan that we're enacting now that says if you are a hospital or a doctor and you're providing very high quality at lower prices below the midpoint, some charge high, some charge low. If you are below the midpoint, we are going to give you a financial reward for allowing you to provide services that result in high quality for our people at lower prices. This is not a theory. This is what we are actually doing in our state. We will begin payments next year based on episodes that we have in our lives. If our primary care physicians keep us healthy for a year with really high quality, guess what? They will get a financial reward.
Okay, now I count 3 separate things that are giant red flags in that soundbite to me. And I'm thinking most people watching debate last night didn't hear any red flags. Certainly not the ones I saw. And might have, this really sounds good. Working together and helping people. But here's the first thing I saw. This arbitrary acknowledgement of the very high quality, lower prices, and then the midpoint. You got high prices, lower pricing at the midpoint. Some charge high, some charge low. So with the doctors. And if you're below the midpoint, we're going to give you a financial reward. So government still is involved in this. I mean, as they are involved in it now. But now they're picking winners and losers. And now they're going to tell these doctors, look, if you come in and you charge below our arbitrarily set midpoint, you come in and charge less, we're going to give you a financial reward. I think most people applaud that. That's great. I don't. Where's this financial reward coming from? And how does that end up saving money? Who pays for the financial reward? Taxpayers do. What is the financial reward? What kind of incentive is it? What's the point here? This is just, it's not quite a Ponzi scheme, but it's robbing Peter to pay Paul. What is this financial reward to keep prices low? It's so somebody can say, I got the prices down. Look at our prices. And over here, you're going to fill them up in the back pocket and the back end that nobody sees with an amount nobody knows. But it's still government doing everything, and it's still government dictating and influencing the market, which is not going to result in actual prices being lowered. It's all being made to be artificial. And the key to that is the next word. If you're below, you're a doctor, if you're below the midpoint, we're going to give you a financial reward for allowing you to provide services. Spoken like a true authoritarian. For allowing you to provide services at a lower price, we are going to provide you with a reward after we've allowed you to provide service. And then the last thing, if our primary care physicians keep us healthy for a year with really high quality, guess what? They'll get another financial reward. It's up to the doctors to keep you healthy for a full year with really high quality care. You have nothing to do with it. As far as the government's Ohio is concerned, it's somebody else's job to keep you healthy. And if they do it for a high full year, then they're going to get a reward. What are you going to get? I don't know. Continued access to insurance coverage or what. The bottom line to me is what I heard in this answer is more and more government deciding more and more, affecting more and more, under the guise of doing just the exact opposite, which it can't possibly do. We'll be back here.